People, welcome. Today is a good day. Mondays are always working day. So I guess even if the life is starting and I might be called because Mondays are busy days. So let's just start and talk about the topic of this week. The topic of this week is bipolar complications. Bipolar complications. So welcome everyone who is here. Welcome to the chat. Welcome to the channel. Welcome for the new people. Welcome to the channel. Welcome. It's a Monday here. At least today the sun is up. It's not cold as usual. We're gonna talk about bipolar complications. What do you understand by bipolar complication? Wow. What do we understand by bipolar complications? As just we talked about the other complications, the neurodevelopment complications. We talked about autism. We talked about partially about schizophrenia, which is psychosis, and we talked about ADHD. And ADHD, we saw it is just like neurodevelopmental, like the other one, which is neurodevelopmental. Ridley is here. Ridley, welcome. Good morning. I know it's morning time where you are. Hope you are doing good, Ridley. Hope everything where you are is okay. So I'm just introducing the topic and telling people to welcome in the chat. Welcome to the chat today. We're talking about something else. We're talking about bipolar complication. And we had talked about several things. So welcome, guys. If you are new, let's know that you are new in the channel. Let's get to know where you are watching from. Good morning. The internet gave me problems yesterday. Yes, and I got an emergency. I had to go and save someone. So 50-50, no worries. Are you new? Are you watching me? Where are you watching me from, my guys? Which side are you watching me from? Let's get to know where you are watching from. If you are new to the channel, please ask what we do here. We do a lot of things here. We talk about medical issues. We interact. We help each other about everything. So welcome to the channel. If you are a content creator, again, let's get to know what you do where you are. Oh, Queen, good morning, doctor. I looked for you on my live yesterday. Yes. I texted and went mute. No worries, Queen. Sometimes events carry us around. You are an amazing work sharing your knowledge. Yes, I can see even T is here today. T, welcome to the chat. Welcome, T. I've missed you, T. Where are you from? Where are you chilling at, T? Don't go like that. Don't make me miss you a lot at the chat. Sometimes text and rewatch. Y15 King Win. Hi, bro. Y15 King Win. Which side are you coming from? Are you in Africa, in the US, in Australia, anywhere, Asia? Yeah, I've been busy, man. Yes. T, I understand. I understand sometimes events can carry you until even coming online becomes, Middle East. King Win is, we have a new friend today. It's called King Win. King Win is from the Middle East. Thanks a lot tuning in, King Win. Interact with the people at the chat. If you are a content creator, let's know you. Yeah, but subscribe to the channel and see what we're gonna do. We have a good team here. that we interact with. Be part of us, Kingwin. Yeah, be part of us. We are a good community here. We do marvelous things, and you will understand. I can see Jamaican uncle in the house. Jamaican uncle, welcome so much. There was a live that we did with Jamaican uncle yesterday on his page, and it was really touching. Kingwing, I'm a doctor. You see, I have this, I'm a doctor. I talk about medical issues, and we interact here with different people, and we bring so much change to people. So Kingwing, be part of us. Like and subscribe. Let's get to know each other. If you have something that you are doing, Kingwin, let's get to know. Interact with the people. So the topic of the day today is bipolar disorders. And bipolar disorders, it's not like, Dino, what is a dono? What can I do a dono? What is a dono? I don't understand that. Please tell us what dono is. If you are a new person and you're watching me from the first day, please come in the channel, subscribe. Let us know you. Let us know where you are from. Yes, you can do a donation. Kingwin, donate if you can. Hey, thanks a lot if you donate. Kingwin is asking if he can do a donation. Welcome, Kingwin. Your donation is respected, and we will thank you for the donation from where you are. Thanks a lot for your donation. So I was welcoming new people, all new people that you are watching. The topic of today is bipolar complication. We have done some, okay, thanks. If you try, it's okay. It's okay. We have done autistic complication. We have done ADHD, attention deficit, and these two are neurodevelopment. Bipolar disorder is kind of like, you can get it in neurodevelopment, but you can also get it in psychotic disorders and so-called other complications. So it depends with what you are having. So welcome every new person. We like visitors, and we like making new friends. You see, we are a very big team. We are a very big team that is team positive. So like the stream today is a Monday. You know, when you start a Monday, you should start it jovial, with a jovial heart. Jamaican uncle, thanks a lot with that stream that you did yesterday. It was a life-changing stream to some of the lives of some other people, and you saw it. You saw the presence of God there, and you saw some change in perception and how people look at life. But it was a changing thing. I really liked it, and not only me. So many people have commented about the live stream that we did yesterday. Thanks a lot for that. I think that is the real positive. It is the real positive thing, real positive change that we should be having. Because if one life is appreciated and one life is changed, it means a lot. If you have not watched that live, please go back to Jamaican Uncle live yesterday on Sunday. In Kenya it was at 7, I think in the US and other countries it was afternoon. Yes. So welcome everyone to the channel. Kingwin, welcome. Stay around, get to know what we do, like and be part of the community. We have to enlighten those people that they really need it. Yes, it sure was great listening to the live yesterday, although my internet was bad. Yeah, it was charging. Yes, internet sometimes, you remember even me some times ago, my internet was bringing up and down issues. Now, the topic of today is bipolar complication. And what do you understand by bipolar complication? What do you understand by bipolar complication? If you are new, please tell us what you understand. Let's understand about bipolar complication. Bipolar complication is a mood disorder characterized by episodes of mania or hypomania. Mania is abruptive disorder, aggressive. Hypomania is a person that is not aggressive. Abnormal elevated mood, energy, and impulsiveness. That is mania. And depression. Sometimes a person can have low mood, hopelessness, and fatigue. And sometimes mixed features of mania and depression. This is what we call bipolar disorder. Every one of you here have ever come across a person with bipolar complications. I understand several of us here have seen these people. Excellent live stream with Jamaican uncle and awesome informative today, doctor. Thank you so much, Queen. That is what we need. We need some content that will change the society, a content that will come up with positive impact to some people. You see, Marcia, good morning, Benjamin and everyone. Good morning, my friend Marcia from Kingston, Jamaica. Or it's not Kingston. I think you come from Kingston, Jamaica, Kingston town. Kingston is a very famous town in the world. Kingston and Tenement Yard in Jamaica. Those are very famous places. Everyone knows Kingston, even if you have never reached Kingston. So let's take what is a bipolar. Portmore, Jamaica. Portmore. Very soon. My bro is here. Savior man. Today, Savior man has made it. Dr. Ben, good morning. Good afternoon in Kenya. Yes, it's good evening. 4 p.m. Going to 5. T is here today. My friends are here. T, Savior man, Marcia, Jamaican uncle, Queen, Ridley. You see. All those friends of viewers that are here, all of them. And I have a new friend called Kingwin. Kingwin is our new friend. Welcome to the channel. Thanks a lot for being here. And I thank you all that have made it to today's topic, that is bipolar disorder. Bipolar disorder is a complication that disturbs so many people. So how does it come? Bipolar disorder, the exact cause is not fully understood. Marcia, sorry, I don't know why I had laughing emojis. Oh, okay. It was feeling nice. You know, when you see someone that you have not seen for some time, you feel excited. I think that's why you gave the laughing emojis to Marcia. Excitement, T. That's it. Yes. Now, we cannot categorize bipolar into brain damage. Dr. Ben, I'm so sad my schedule changed at work. No worries, Savior man. You remember I sang for you Hustle Hard. And that is part of the hustling and making it in life. Making it. Yes, T, when you see someone after so long, you get excited and you smile. And when you saw Marcia, you had to smile. You get it? You had to smile. Marcia, I hope my dream next year will come. My dream next year is to visit Jamaica first. Jamaica. I feel I just want to visit Jamaica. So Marcia, from Jamaica, Portmore, Jamaica, Jamaican uncle, I think next year we will touch down there. I really want to visit some people in Jamaica and see Jamaica itself. Yes? Savior man, no worries. New people in the house, you're meeting Ben, Dr. Ben. Thanks a lot for being in the station, in being in this platform. The station is called Benjamin the Wise Guy. Yes. And Ridley, Kingston girl, big city, Marcia. Good morning, Kingston girl, Kingston town. UB40 sang about Kingston town. Bob Marley sang about Kingston town. I want to visit Kingston town, even me. Yes, Kingston girl. I want to visit Kingston town. Yeah. Now, how does bipolar disorder come? Bipolar disorder is not, the pathophysiology is not really known. Dr. Ben, did you get my message on WhatsApp? Yes, I saw it. And I replied. Just check, you will see, Savior man. I replied. Now, the problem when it comes to bipolar, before I continue, everyone in the chat, have you ever met someone with bipolar complications? If you have ever seen someone with bipolar complications, please tell me. Yes, how was your relationship with someone with bipolar? Be it your brother, your sister, your relative, your friend. How does this? Oh, T, you have it. Today you will learn a lot. You will even learn how to maintain. But T, were you diagnosed by a doctor or yourself? You know, some people we diagnose ourselves. You met someone. I can't deal with them. Okay, T is not bipolar. T says T has met someone who is bipolar, and dealing with them is a problem. anyone else, my friend, today I look nice. I've shaved. Today I went to the barber shop early in the morning. I shaved. At least I look better. We can't wait, Dr. Ben. Yes, I can't wait to visit Kingston Town, Jamaica. And Uncle, promise you will take me to the Bob Marley's Empire. Bob Marley. I want to sing in the studio. I'll visit that because I have been told that at Bob Marley's home there is a big studio where artists go and do their music. I want to visit that place and visit Marcia Thompson. I want to visit Marcia Thompson too. So I have never met a Jamaican. The first Jamaican you will meet is Jamaican uncle. T, one day. Now, anyone else who has interacted with a person with bipolar disorder? If you have ever interacted with a person with bipolar disorder, tell me. Tell me if you have ever interacted. How was your interaction? How did it? I mean, in person. Oh, in person. Okay, no worries. T, in person we will arrange. As I'm moving up and down and going through the ABCDs, you will bump into Jamaican uncle and me very soon. My sister Kingre is here. Kingre, how is the going? Today I was following you very silently. I couldn't text. I was going so silent. But I was on your chat. Sometimes I go to chat silently and people cannot know. So I'm asking this question. Okay, let me check. Yes. Have you ever met someone who is bipolar? How was your interaction with this person? How were you interacting? How was the interaction? Because sometimes bipolar is a funny thing. It can get people nuts. So let's get to know. What are the things that, Dr. Ben, I like your haircut. Yeah, I feel, if I sometimes Savior man, I am very busy until even getting a haircut is a problem. You get? But I think when you shave, you feel light. Today I feel light and I feel younger. I say they are very confrontational and very unstable mentally. Yes, by bipolar disorder, we will see that. You see, T has met them. Anyone who has met someone who is bipolar, anyone, even if you are a new person in the house, please tell us. Some people are new and they fear talking. Here we don't fear talking. You text whatever you think. This is the only platform you text, even like a psychotic person, and we listen and we look at it and we laugh and we try and help me. I help you. There is one guy I've not seen for a moment. A person who texted several things. I think the person had issues, maybe under stress or several. He's not texting again. I hope he'll come back. Who has met this person? How much is your haircut in Kenya? In my country, Benin, with $1 you can have a clean haircut. It depends. Me, I pay around $3.50, $3.50 for a haircut, Savior man. 3.5. I can talk all day. Yes, Steve, we love talking. We love talking, man. We love talking and we love interaction and we love interaction. Have you ever met? It's only T who has said she has met someone who is bipolar. Anyone else? I'm introducing bipolar complication. I'm introducing bipolar complication. And I will introduce even a complication that is called hate. I'll introduce hate. Hate is part of mental health complication. I'll introduce it. Hello T, nice to see you. Who else have seen a person who has bipolar? How was your interaction with this person? Did you hate this person? Did you avoid this person? Were you close to this person, or you just had enough and you stayed away? I spent 40 USD here. Okay, very expensive. Yes, it's 40 USD is expensive. I always have a soft heart for those people, and I don't think it's a problem to be like that. Yes, I would like to visit Savior Man City when I visit again. Yeah. Savior Man, Ridley would love to visit you. Ridley, I saw you driving a big machine, and that big machine makes me feel like when I'm visiting there, I will not like to be with a small machine. I would love to to have that big machine. Very reckless. I will avoid them at all costs. They'll drive me nuts. Oh, you see, that is, people have different ideas. Now, Uncle says, I always have soft heart. But T says, they are very reckless. Have you ever met someone who is bipolar? Let's get interacting before we learn. New people, please subscribe to the channel. Tell us where you are from. Tell us where you are from in the chat. Everyone who is new in the channel, welcome. Tell me where you are from. Tell me how you feel about the community that I have. The community I have here is Jamaican Uncles community, Ridley's community, Queen CNLB community. There is a sister of mine who will be here soon called Chat Rabbits community. Don't just leave without liking. Hit the like button and let's learn together. Let's exchange ideas. The ones I've met are crazy. Yes, T, there is a difference in bipolar complication. It is characterized by mania and hypomania. Oh, coffee cakes, get my hugs. I saw your post, coffee cakes, get my hugs where you are. Get my hugs. Coffee cakes, remind me where you are, please, which country you are from, and specific which town. Please remind me. New people in the house, why are you just chilling? Dr. Ben, Mom Sha Travels is at work now. Yeah, I know she's at work, but just wait. You will see Mom Sha Travels here. It's just right about now. I miss her. We had a discussion yesterday. Everyone, you saw how Mom Sha Travels is a good lady, a person who has kind heart, and a person who likes interacting with good vibes. If you have not connected with Sha Travels, please connect with her. I'll say I can't keep with them. They are getting too much energy. Yes, that is T25. The coffee cakes, tell us. I need people to know which state and country you are. Please, I'm in the US state of confusion. Coffee cakes is listen to what coffee cakes is saying. Coffee cakes is saying, I'm in the US state of confusion. Laugh out loud. The state of New Mexico. Jamaican uncle, when you are planning to visit Mexico, please see the coffee cakes. I think we will visit with you one day. Thinking you was in Africa, Savior Man. No, Savior Man is in the US. Welcome, coffee cakes. Thank you a lot for your participation yesterday. We were blessed and we transformed some lives. Thank you so much for your participation. Okay, the topic of today is bipolar complication. And bipolar complication has several things that are, it is between the new state of Texas and Arizona, not in Mexico. Oh, it's in the state of we coffee cakes. Wow, coffee cakes. Come to Alaska. It's so beautiful and very quiet. I've seen some videos of Alaska. There was a time Uncle asked me, would you like traveling to the US? That time I had a lot of things, and even now I have a lot of things that I'm doing, guys. Pray for me. Pray for me, my guys. My head is like having a lot. You understand? So I told Jamaican uncle that for now it will be hard, but when I start traveling, I will be always taking Jamaican uncle on trips. On trips. But all I ask is my family, my people here, please pray for me, pray for this head, pray for it so that it cannot burst. Just pray for it so that it cannot burst. To continue having that energy to push and push. Sometimes I feel I'm pushing too much, but Uncle always tell me push and push, don't stop. The energy that Jamaican uncle give me, it's quite Odik, thanks a lot for being here. Thanks a lot for hitting. We are talking about bipolar complication, and today we are introducing bipolar complication. So my guys, everyone who is in the chat, everyone who is here, thanks a lot for hitting here. Thanks a lot for being around. Thanks a lot for being in the channel. Everyone who is new, welcome to this channel. This is a channel that you will be comfortable, a channel that you will meet positive, good friends in the chat. You follow the positive, kind-hearted people in the chat. Welcome. Subscribe to my channel. Like, please tell me I've liked. Come on to the chat. Tell me I'm new here. What do you do? How can I interact? You get it? And then you feel blessed and you feel better as we continue. And if you have something that you do that you need assistance or you want us to boost, maybe you have a business somewhere and you tell us, this is what I do. My business is this. Maybe we can support you, or some people in the channel can give you a boost. Bosire, welcome, Bosire. Today we are talking about bipolar complications. So bipolar is not neurodevelopmental. Bipolar is not like ADHD and the other one which is called ADHD, and the other one which is called what? Autism. This is a complication that the known is not known. The known is not known. Bipolar disorder is a mood disorder characterized by mania and hypomania. And this means abnormal elevated mood, energy, and impulsiveness. The T has told us they have excessive energy. Yes, that is called mania. And less energy at times is called hypomania. Yes, autism and the coffee cakes, autism and ADHD, those ones are different. Those ones are called neurodevelopmental. They are affecting the brain since conception. But here we have a bipolar complication, which is not neurodevelopment. We are going to know extreme high and lows and anger. Yes, extreme high and lows and anger. You see, and remember, Queen has said, prayers sent to all caregivers. Every person who works in medical industry is a caregiver. So let's send all the prayers to caregivers, because they make it sure that everyone is okay and everyone is supposed. So a doctor is a caregiver, a clinician is a caregiver, a nurse is a caregiver, a psychiatrist is a caregiver. Everyone who makes it for a person to be okay, that person is a caregiver. So Queen, let's give all the prayers. You see, even Queen, I'm asking people in the group to pray for me, my friend. Pray for me, because Sometimes my head feels like it can burst because of everything that I'm doing. But all in all, God is giving us energy daily. As you wake up, you feel rejuvenated. Send prayers to the US military also. Yes, because they are protecting the US. Okay. Celia man, are you in the military or you wanted to join a military? Okay, now, depression, low mood, hopelessness, and fatigue. People that have bipolar complications have depression. Some mixed features of mania and depression. Those three things. If you have ever met someone who has bipolar, they have mania, hypomania, depression, and sometimes the mixed features. Yes, caregiver is a very tough job. You're dealing with different personalities. True, T. True, T. It's very true. And sometimes you can be injured through the process of being a caregiver. Something can happen to you. It's very hard. Yes. Now, in bipolar disorder, we have said it's a condition, it's a mood disorder characterized by three things: mania and hypomania. That one is mood, high, excessive. Don't forget about a blue demonster from yesterday. Hey, where is she? I hope she'll be here. Don't about blue demon slayer. I hope she'll be here. She has my number. She has a text. I hope she'll catch up with us. So we have mania and hypomania, depression, and sometimes mixed features. Mixed features are like mania and depressive disorders. Anyone who is new, please, and watching, the topic of today is bipolar disorder. Bipolar disorder, and I like when people who are new come to the chat, and then they text, they say what is going on here. We tell them this is a good platform that we discuss everything. A caregiver is anyone who cares for others who cannot care for themselves. Self-care for caregivers are essentials. You see, everyone, what Queen is saying, a caregiver is anyone who cares for others who cannot care for themselves. Self-care for caregivers are essential. There is one thing that, before I continue about bipolar, there is one thing I want to say about that statement. A caregiver is anyone who cares for others who cannot care for themselves. Self-care for caregivers are essential. If these people are taking care of others, who is taking care about this person? Who is taking care about this person mentally? Who is taking care about these people mentally? Sometimes we need to check about how we handle some issues, how we handle some states, because you can be handling issues upon others, but you are suffering. Many caregivers are undergoing depression because of what they are going through, and no one is noticing. Many caregivers are undergoing traumatic scenes, and no one is knowing the depression that they are undergoing. Let's think about it. Now, let's go to pathophysiology of bipolar. The pathophysiology of bipolar. How does this come up? The exact cause is not fully understood, but take care of yourself first. Self-love first. Yes, T. You can take care of yourself, but during the response and your work profession, you start having depression because of what you are seeing and what you are undergoing. So we need to be close to each other and follow up to each other. Now, bipolar is genetic. At times, we have said the complication is not fully understood, but what you are saying, it may be genetic. It may, the neurotransmitter imbalance, you may have it. Brain structure and function abnormality may be there. Cardiac rhythm disturbance at times. Cardiac rhythm disturbance is how you sleep, how you wake up, the clock, the natural clock, neuroinflammation, the inflammation of the brain and the nervous system, hormonal stress and dysfunction. So all of these are considered part of what is going on. Take care of other people is a blessing from God, yes. But you have seen the exact cause is not fully understood. That one you should check on it. I've asked if some people, if anyone have ever come close to a person who has this problem. Have you ever come across a person with bipolar disorder? Tell me if you have ever come across a person with bipolar disorders. Some have said yes, like T has told us, and he has told us some mood swings, hyperactive sometimes these people have changed. How did you find this person? Let's talk about it. How did you find this person? How did you interact? Because this is now, it's not neurogenetic. This is not like it's Mr. Louib. Mr. Louib is here. Hi, Mr. Louib. How is the going? How is the going? How is the going, Mr. Louib? Where you are? Letting to know how you are and how you are going is important for us also. And there is a lady that I've not seen for some time. If you know Elaine, Jamaican Uncle Ridley, and others, T. I know you know Elaine Purdiau. I've not seen Elaine online for some times, even in the Marwa's chat and Jamaican Uncle. So please, if you are close to Elaine Purdiau, please check out on her. Tell her Benjamin asked about you, or I have her email number. I'll email. Oh, you saw her. Okay, that's nice. I'm grateful about that. T, I'm grateful about that. Good session. Yes. Now, Mr. Louis, welcome. Hope you have liked the flow. Mr. Louis is one of my subscribers. He's always here. Welcome. Today's topic is bipolar disorder. So, Mr. Louis, if you know about bipolar or you've met someone who is bipolar, please let's get your interaction. But here we say its exact cause is not fully understood. But you will share it to me. I'll email her. I think even me, I shared an email with her sometimes back. So the exact cause is not known, but there are some things that doctors are researching into people that are bipolar. And these are genetics, neurotransmitter imbalance, brain structure and functional abnormality, circadian rhythm disturbance, neuroinflammation, hormonal and stress system dysfunction. You get hormonal and stress system dysfunction. Shanim Miriam, welcome Shanim. How is you today? You are here. How is your channel going? Let me check on Shanim's Miriam channel. Okay, 782. Now Shanim needs our support. If you go and check on Shanim's channel, she's here. She's a new person. She's new and she's one of us. So Shanim, welcome. Interact with the people at the chat. Let the people know you, Shanim. Let's grow. Let's grow together. Let's get to grow together, Shanim. And we progress well. Today's topic is called who Elaine was the first lady on YouTube I met who cash up me. Oh, nice. Thanks a lot for that. Today's topic is bipolar, and let's interact. Interaction helps people to know how things are. So exact cause is not known, but the 6 items that I've mentioned are the ones that I'm good. Yesterday people subscribed and unsubscribed. Oh, Shanim, they did not unsubscribe. It's because they subscribed and they haven't watched anything. So if a person subscribes to you and you know the person, go to that person's chat and watch a video and leave tell that person you subscribed, but your subscription went. That person will know what to do. If you subscribe to a channel and you don't watch, sorry, let me pause it. Yes, sorry, Shalim, sorry about that. No need, they will come naturally. Yes, if they start watching, the subscription comes. Shalim plus YouTube verifies too, so they take the give back. Yeah. Welcome, my guys. Today we are doing bipolar, and we have said the exact cause is not unknown, but hormonal stress, inflammation, cardiac system, brain structure, and neurotransmitters are under investigation. So genetic factors are bipolar disorder as one of the strongest genetic links among psychiatric illnesses. When people are talking about people that are living within us and they have psych issues, the genetic ones, this one is the best and it is known. But you know, when you take a person to the MRI machine and you scan, Dr. Ben, Miss Elaine is a cancer survivor. Yes, we have talked with Elaine and we talked about it, and I've not seen her for some time. That's why I was asking. So if you take a person who has bipolar and you take it's MUB, and you take that person to the machine, the brain is okay. You get? So that is why some things are under discussions. Now, genetics. Bipolar disorder is strongly attached to the genetics. And important points to note when it comes to genetics is first degree relatives have increased risk. First degree relative, your child, how can you prevent bipolar? Oh, that was the question that I saw from the start coming. People always ask me that question, Shani Miriam. We are just introducing bipolar and we will know how to prevent it. So let's get to know the pathophysiology. Let's get to know how it comes about. You get? So we have said identical twins show high concordance rates. If you are identical twins, both of you can have it. If in your genetic line you have. Multiple genes are involved, polygenic disorders. You see, it is genetic. So genes, there are some genes that are associated with bipolar disorder, which is this one are a bit complicated. One is called CANCA1C, which controls calcium channels in the brain, in the body, in the vessels. There is another one called ANK3 and the one called clock gene that regulates sleep-wake disorders. You know, these genes affect neural excitability, mood regulations, and synaptic complications. So most of bipolar disorders are genetic. And you see, if something is under investigation, what you can really do is to use drugs that prevent the episodes. Shani Mariam, you understand? Shani Mariam, have you ever come across a person who has bipolar disorder? If you have, tell us how you found, how you saw this and how your experience with this person. Tell us your experience with this person. Neurotransmission dysregulation. Now, here we also have dopamine hypothesis. This is, if you hear about theory, hypothesis, These are things that are not proved. These are things that are not proved, and they are things that are speculated. So they are under investigation. You remember we talked about bipolar and dopamine in neurotransmitter problems. So hypothesis, doctors are thinking and investigating about dopamine, excess dopamine activity in your brain. When you think about something, it's a case I saw in one of a news anchor, and it raised a lot of questions to me. Oh, on the name of news anchors. Yes, it's a condition born with, genetic. So you don't blame these people. Some of them are, be it you are a high-class politician, a CEO of a company, you can be suffering. You are very bright, but you are suffering from this. So you are hired on merit, but you are struggling with the condition. You get me, my people? So in the sense of a person living well, when you have, whatever I'm going to say are hypotheses, but there are drugs that are given to limit the outcome. This is not like autism and ADHD, where we know the neural cells were destroyed. You get? And why it gets worse in cold season. Yes, we're gonna go know that one right now. In cold season. Welcome everyone who is new to my channel. Welcome. Let's get to know where you're from. Let me get to know you. Let me get to know you so that we can interact. Let's form that community that is vast. Now, excess during mania, hyperactive disorder, you are having a coffee cakes likes it when I'm singing. Yeah, when it is having interruptive disorder, excessive excitability, it is related to dopamine. During excess dopamine in your brain that is being released, hyperactive psychosis in severe cases. Sometimes you become psychotic. If you have ever met a person who is bipolar, sometimes they even become psychotic. Grandiosity and increased energy. If you can come, I don't know why. Sometimes when dopamine is released excess to your brain, it makes a person have a lot of energy. Because some people who are psychotic, you cannot handle them one person. You have to have security of people that have muscles to handle one person. But if a person is normal, can be handled with one or two people and it's okay. So dopamine is something that gives people a lot of energy when it is released in the brain at high levels. Who is that watching and does not like it? I can see new people coming, peeping in and out, and they are asking themselves, who is this talking about things that we know? Some things you may not know them in a good way, or in a depth, in the good level. You may be confusing things. There are some people, even they didn't know autism is brain issues. Some people never knew. But when we talk, you understand they knew. During depression, you find that dopamine in the brain is really reduced. So as per what I'm saying is, you see, we have something that is called serotonin dysfunction. Let me tell you, in your brain, if your brain has a problem of giving out serotonin is a neurotransmitter that is released in your brain. You will start having depression, having suicidal thoughts, irritability and anxious always. Irritable and anxious always. Serotonin normally regulates mood, sleep, and some other things like appetite and impulse control. Serotonin always controls all this. You get me, my guys? Let's interact. How did you see these people? By the way, how many people have bipolar and they are in a relationship, they are married and everything is okay? Hmm? Have you ever met a married couple who both are bipolar? If you have ever met a couple that both are bipolar, please tell me. I hear you. I hear you straight. Okay, the neurotransmitters in the brain are three important. Jamaican uncle says he does. How is the couple? Best, without issues, they understand each other well, and life is good. Now let's talk about neurotransmitters. No, but I guess it can work out if they are on medication. Yes, T, that is correct. That is very correct. They can work. It can work out if they are on medication. We have 3, 4 lots of problems. Jamaican uncle, true. There is a lot of problems, even of understanding. We have 4 types of neurotransmitters. 1 is dopamine, 2 is serotonin, 3 is norepinephrine, and 4 is gamma glutamate. These are things that are maintain mood. They maintain how you are relaxed. Like me, you see, I'm relaxed. I'm interacting amicably. I'm interacting well. We don't have a problem. You see, Coffee Cakes is taking notes. Yes, it's good to take notes, Coffee Cakes. Let me repeat, that one seems to be a good long way to get there, but whoever they are, more power to them, because that's tough. Yes, T, that is very correct. It is very tough. So, normally, in the brain of a person, some chemicals, they are called neurotransmitters. These chemicals are 4. Let me repeat. Dopamine, norepinephrine, GABA glutamate, and serotonin. Those are 4. If one of these is reduced, you will have a problem. If one of it is not regulated as the mood and time, it will have a problem. Because when it is time of being happy, dopamine is released, and then you become happy. You start laughing and you interact with people in a good way. You get it? Let's talk about serotonin. If serotonin is released and it is low, you will always be having irritability, anxiety, suicidal thoughts, and depression. Always. You will always have depression. And it is the one which regulates depression and anxiety. Now, glutamate. Glutamate in bipolar disorder, this neurotransmitter, if it is low, reduced, you will have overexcitation, you will have anxiety, you will have mania. Mania, it means you will always, I'm looking at someone there. You will always have problems when it comes to interaction. Alimig is here. Hello, Doctor. Greetings to everyone on here on live. Welcome, Alimig. Welcome, Alimig. We are talking about bipolar complications. If you have ever seen someone who has bipolar, Alimig, please tell us. How was it? That is the discussion. But I have a question that has been asked by Shanim Miriams. And why is it getting worse at cold season? And the other question is this one. How to prevent bipolar? Those are the first 2 questions we have. We'll deal with them. So everyone who is watching, welcome. Make sure you've liked and shared to someone this topic. I knew someone with mania or hypomaniac depression. They took lithium. Yes, lithium is a mood stabilizer. Lithium is a mood stabilizer. It is very, when you take it, if you are hypomania, you feel relieved, you feel better, you feel relaxed, and everything is okay. You feel relaxed and everything is okay. Now, when GABA glutamate is down, anxious, overreactions, mania, overreacting, poor emotional control. It feels like GABA is the one that is suppressing dopamine. So dopamine is the opposite of GABA. You see? So when it is down, problems come. When dopamine is high, you are always hyperreactive. You get glutamate. It's the main excitatory neurotransmitter. Yes, his family was afraid of him. He was violent in the digits if he didn't get his way. Yes, they are very violent. It's because here we are seeing when dopamine is high, you are aggressive and you can't sleep, and energy comes. Some food can also trigger people. Yes, some foods can trigger, that is true. Let me get this straight. Some foods can trigger because you can eat some foods and then dopamine is highly released. When dopamine is highly released and the foods because of foods you have eaten, you will be aggressive, energetic, you will want to beat everyone. If you are bipolar, during depression, low motivation, anhedonia, and fatigue. So when dopamine is down, you start having depression. You are very energetic at a point, but at some point you are very down. You get real tea. Makes sense. Sensory. Yes, very important. Foods are very important. Wow, if serotonin is down, you get depression, suicidal thoughts, and irritability. So serotonin is the main thing that makes you stable. You get, makes you stable. Now, let's get to how these things come about. The brain structure. The brain itself is God created the brain in a funny way. Nowadays, we don't know what they are actually adding in there. Yeah, you buy food and then people start becoming. Which type of food are you talking about, Tim? Let's see. Some foods. You have said some foods. Please tell us some of them that you understand. Some of them that you understand. Okay. The brain structure. We talked about the prefrontal cortex. Remember prefrontal cortex, where dopamine, norepinephrine comes from. Where you think about, it helps you to judge, it helps you to think. I notice my other half is meanwhile when his sugars are low. Oh, it's mean. Okay, Chwea, welcome, Chwea. We are talking about bipolar. How do you think about bipolar, Chwea? Chwea from Qatar, Kenyan living in Qatar. I've never been in Qatar, but I'll be there soon. I'll be in Qatar soon for a visit. Now, the prefrontal cortex, it gives you judgment, decision making, impulse control, all that they are given from the prefrontal cortex. In bipolar disorder, reduced activity. I'm 100% vegan, so I don't know. I don't eat sugar too, but probably processed foods. Yes, processed foods are very many things. And let me tell you one thing. Some things that you take as processed foods are not the real foods. Some people have mastered the art of getting a certain flavor while you are eating something that is not the same thing. You can be eating meat, something that is like meat, but people have done engineering and you are just feeling the flavor and it has no any other component of meat. So let's take care about it. It's hard to avoid, especially if you can't cook. Yes, it's hard. What can we do now? Very hard. And you see, at areas that organic food to get is a problem. It's very hard. So prefrontal cortex, we have talked about it. In bipolar, in prefrontal cortex of the brain, it has reduced activity. So you get some people have problems with poor judgment, risk taking, and impulse issues with impulse. You get it's where you are just here right now. Tell us about if you have ever met someone with problems with bipolar issues. Have you ever met someone with bipolar? Savior man is at work. Hope Savior man will come. I hope Savior man will come around. Sure, have you ever met someone with bipolar? How was your interaction with her or him? Now, in your brain, there is something called amygdala hyperactivity. Amygdala hyperactivity. This is where you process emotions. I cook all my food at home. I do know restaurant food, but my parents have a big greenhouse. I get veggies and fruits from there. Yes, nice one. Wow, I like the big greenhouse of veggies and greens. Horticulture. Gee, that is very nice. Your parents are good people. They know about living healthy. Now, amygdala hyperactivity. Amygdala is where it's part of your brain that processes emotions. The way you feel, the way you perceive emotions, the way you bring out things. The amygdala is the center of it. You get? In bipolar disorder, increased amygdala activity. Emotions. You know those people are highly emotional. So that part of the brain that is called amygdala, it is very highly, it has high activity. Amygdala, your brain. I know people know about the one that people say the cerebrum, and the others, medulla oblongata. Some people, when they are very frustrated from someone, they usually tell that people, your medulla oblongata does not function. Welcome, new guys. Welcome, people that are new, that are watching to the platform. This is Dr. Benjamin, the wise guy. If you are watching for the first time, please subscribe, share the content to others, and leave a like and chat again. Tell us on the chat where you are watching from and what you do. I haven't come across doctor. Oh, it's true. I've never met someone who has. It's true. I've never met someone who is having this problem. It's true. It is hard when you will meet one and that person maybe has not taken the drugs. You will feel it. I don't know if I like to deal with highly emotional people. T, do you like dealing with highly emotional people? It seems you have a problem with highly emotional people. Life with the Russells. Hi, Doc, and everyone in the chat. Life with the Russells. Welcome to the chat. Masitai, I see you. Hi, I see Masitai. How is your sister Judy? I saw Judy here a while ago. Please say hi to your sis. She's here. Now, right with the Russells and Masitai, we are talking about bipolar complications. Have you ever come across people with bipolar? How did you handle it? How was it? How did you handle it? If you saw these people and you interacted with them, please tell us. And I Nene and Mom is he. Good day, dog. Nene, I saw you are live, but I couldn't see you. It was very dark in the evening. Date with a crazy woman. Maybe yes, I do. I'm in healthcare. Oh, life with the Russells. Welcome. Now you understand how is your interactions with in daily life, right, with the Russells. You know, we have said the real cause is not known. We cannot say it's like autism and ADHD. Here, it is hypothesis and theories, and the more hypothesis is about neurotransmitters. The neurotransmitters we have said are 4 of your brain: GABA, norepinephrine, dopamine, and serotonin. So the imbalance of these neurotransmitters are chemicals that maintain your mood, maintain how you react, hyperactiveness. Let me read about this. Yes, I met someone like that, and she asked a simple question and we told her no, and she turned her baby upside down and threw the baby on the floor. Everyone was crying and calling out for Jesus. Wow. Okay. Was she diagnosed with bipolar or it was psychosis? That one is more like psychosis. I let them speak till they finish out the breath and listen. Try to avoid triggering words. Yes, try avoid triggering words, because if you trigger them, things may go upside down. I won't be able to participate because I'm on my way out. Okay, life with the Russells. Okay, nice. Thank you so much for coming in and listening to the topic. I know we will interact. The coffee cakes, we didn't know that. Okay. My goodness, coffee cakes. Now, I've said the neurotransmitters, the 4, are the ones that are regulating your mood. So anyone who is here and is new, please tell us where you are from. Tell us where you are coming from. Tell us your channel. If you are a content creator, tell us about yourself. If you are okay. But if you are just passing by to listen to our discussion, we love you. Please listen and give me your subscription and your like. It's very important. You get? It's very important. Now, amygdala, a part of your brain that regulates emotions, fear, anxiety. So people with bipolar disorders, my friends, people with bipolar disorders, know that in your brain there is a place. Thanks, Life with the Russells. I would like to interact with you more when you have some time. You know, I like interacting with different people from different areas that are in the health profession, so that I can know more about how health profession out there it is. So people with bipolar, there is a place in your brain that is called amygdala, whereby it regulates emotions and several things. Just know that that place has a problem. The coffee cake says, oh really, I'm not sure that situation. I'm sure you did the best you could. I was talking about what I said from previous interactions with irate people at my work. I suspect some were bipolar. Yes, bipolar, let them be diagnosed with from a doctor's perspective, because you may confuse psychosis, the real psychosis, with bipolar. Some people are psychotic and people say that they are bipolar, and that one is misdiagnosis. I'm just introducing today bipolar, and we will get to know about the diagnosis of bipolar. There is somewhere in your brain that is called the hippocampus. Nene and Mom is saying this is very interesting. Yes, it is very interesting. Autistic people have the crash out too. Yes, and there are some people that are autistic and they have also bipolar. So hippocampal changes means memory and emotions. Chronic illness may cause reduced hippocampal volume. Your brain has amygdala. You know, you always know about the medulla. So let me tell you the one you call medulla oblongata. Now, today let me introduce you Rich Kusu, welcome, Richie, let me call you Sue. Welcome to the channel. We are talking about bipolar, and people know about the brain medulla. Today I'm introducing some things that are new to the platform. I'm introducing amygdala, and I'm introducing hippocampus. Hippocampus helps in memory and emotions processing. Hippocampus, you get. Amygdala controls emotions, aggression, and emotional instability. So when your memory is going, when you are losing a memory, just know the hippocampal place have a problem. The hippocampus place have a problem. Reduced hippocampus place. But there is something. There is this thing that when you go home, you feel that you want to sleep. You get? You feel that you want to sleep, and you wake up at a specific time. You wake up. Yes, Dorothy. Yes. Ama akikuja hapa atakaza. I think ukikuja na yeye it will take short time that nikuje tuanze story, si ndio? Hii ni pale bado. Now there is something that is called the circadian rhythm. The circadian rhythm is another thing whereby when you sleep, it tells you, very interesting, Benjamin. Yes, really. It's very interesting. You see, I'm introducing you to new things. You know, medulla. Right now, you are knowing something else that is called amygdala and hippocampus. Now, when you are regulating, you get sleep. The circadian rhythm is the clock of your body. This is the clock of your body, of your daily. So when you feel like sleeping, just know the clock around the circadian rhythm in your brain. Sleep disturbance. This is what clocks it in. And you know, circadian rhythm, including autistic people, but in bipolar is raised. The sleep disturbance in bipolar, the body clock becomes unstable due to dysfunction of suprachiasmatic nucleus, something in your brain. Today, my friends, just listen to these hard words. Don't about them. Very interesting. You should do a question answer on your channel live since you are in Qatar. Nene and Mom, I'm sure it can be, but don't listen to me. Okay, Nene and Mom says what? Nene and Mom. Does chronic illness lead to emotional instability by chance? Yes. People that have chronic illness have instability in emotions, Nene and Mom. But when you are talked to and you are cancelled, it becomes stable. We talked about it when we are talking about palliative management on cancer. When we are talking about it on cancer. Now here we are talking about the circadian rhythm. In your brain, again, there is something called the suprachiasmatic nucleus, where it is regulated by melatonin and clock genes. You get? Nene and Mom, feel free to ask these questions. Feel free to ask these questions. Don't yes, I mean, don't. You know, asking is you get to know more. Yes, my friends, I'll give me some time, a minute, I'll be back. Just a minute, come in. Just a minute, we will continue. Is it possible chronic pain? Yes, even chronic pain, coffee cakes. Just a minute, I'll be back. Umepima BP yake? Vitals. Mbona?
Najua nimekuja ghafla.
Ni kitu imempasua hapa kwa
Maybe I have just felt hungry. Nikaingia kwa hii chips place hapa Ojai. Nikakula tu chips lakini ilikuwa dry.
Yes.
Sasa kukula nikasikia kama kuna kitu imeniguza pale. Hapo nikaanza kusikia kama inafura.
Okay. Nini? Nilete kitu yenye naweza shika hapo. Tutamdunga Transamic.
Naweza kuwa iko pale tu sio.
Kama nini unashika?
Hata zile ni za kushona.
Okay.
Hebu nione. Kuna kitu ilikuwa imefura hapo. Ikakudunga.
Ni kinini hiyo chips? Ina piece of chips. Unajua ikiwa very dry.
Inakata.
Imekata sasa
kuna wood hapo.
Sasa nikaanza kusikia kama inataka kufura.
Guys, I'm taking care of something. I'll be back. Nilikuwa
naona tena kama inaanza kufura,
ina bleed. We have to stop it. You need antibiotic and drops. This places hizi chips ngumu zile hata mimi shaini la roho. Nilete nini haraka. Nini hapo? Ya yellow. Harakisha kidogo. Hiyo inafaa kuwa stopped immediately. You can bleed na kukunywa damu unajua si vizuri. Alafu wewe you give an antifungal. Iko wapi tonic?
Ile kama fura so fast. Sasa kama tena
ime create kidonda na imefunguka hivi. So we have to Dorothy. Na Transamic acid hiyo damu isitoke. Uweke metronidazole alafu uweke nini gluconazole juu ya fungal ya mdomo. Alafu utapea antibiotics tena.
injection.
We have to stop the bleeding. Imekuwa sahi, unaona hiyo.
Just now, I've just got out and got into the vehicle. Kama nimeanza kusikia hiyo inavura. But by the time ikifika hapa nasikia kama ndio nafikiri hiyo damu imetoka.
Hiyo
Kasikia imeenda imenini.
Naona imenini. Damu pate koro.
It's just now. Vile mtu anasikia uko na kajana.
Unaingia
Kana nikasema chips kidogo tu. Lakini ilikuwa imekaushwa.
Tunapenda hizo ndio zimekaushwa.
Nimekula.
Nataka hapa. Hiyo Transamic uanze na gluconazole. Iende slow, alafu the other one ndio utapeana na hiyo antibiotic.
Ambiclox,
IV ceftriaxone. IV ceftriaxone. Mwanzisha hizo nitapeana direction. Yes, nimalize hiyo. Yes, guys, I'm still here, doctor. I'm back. Where are you? I'm here. I'm here. I was handling something, and I'm done. Guys, maybe the other lady wamesema wanasema wanakuja. Sawa. Yes, was handling something, but I'm back. He has a patient, I think. Yes, I'm back. That one I have to handle it. And let's continue. We were talking about bipolar, and we had reached at cardiac. Blue Demon Slayer, coffee cakes. Your friend is here now. Blue D, the coffee cakes was asking about you, and you had to WhatsApp me, Blue D. I didn't see your text. I'm still waiting about your text. I'm here. Yes, you're here. I'm still waiting your text, Blue D. I've not seen it. Now, we are talking about the cardiac rhythm abnormalities. Cardiac rhythm abnormalities. What are these abnormalities? Dorothy, unilete kitabu, I write the treatment. Okay. The cardiac rhythm abnormalities. When you are sleeping, this is the rhythm that takes control when you are sleeping, when you are waking up, when you are doing something. This is the rhythm that takes control. So in bipolar issues, it has a problem, and these all are somewhere in your brain. The amygdala, you see, and the others that have brought to you today, hippocampus region of your brain, hippocampus region of your brain. The smiler in the city. Greetings, doctor. Blessings to everyone in the chat. Welcome, everyone. Welcome. I can see smiler. Blue D. I'm waiting for your text. I'm still waiting up to now on WhatsApp. Now, there are several things that we have said. We have said something that, doctor, then can you also do surgery or no? I always do them, Savior man. I always do them. That is the nature of my work. Always. Yes. Now, we have said these are complications that they are not known, but the theory and hypothesis is still going on. And the main thing that has been put for people that are bipolar are on three things. One is neurotransmitters, and one of the neurotransmitter is GABA. The second one is dopamine, and the other is norepinephrine, and don't forget the other one is what? Serotonin. That is the basis right now of what bipolar disorders are. Don't mix bipolar disorders by neurogenetic disorder like autism and ADHD. Autism and ADHD, they are neurodevelopmental. When a person is conceived in the womb, you remember the staging that we were saying, the stages that we were saying about, the ectoderm cells going in, and then when they are going in, what happens? When they are going in, what happens is they move inside, neural tube is formed, and when the neural tube is formed, you start, efficacy is here. Efficacy, today's topic is bipolar. Savior man boss, I was here earlier, just was checking around my work. Oh, Saviorman is here also. FRC is here, welcome. And everyone in the church. A minute, guys, a minute. I get you. Umeweka tranexamic acid. Imeenda weka tranexamic acid. And then I see Stamaingi. Stamaingi welcome. Leo huku kuna mwangaza mingi sijali. Been online. Na sijakata sijamaliza, so let's just talk and I go back to you did it. Dilated cardiomyopathy is severe by ventricular systolic and systolic function. Mild ARDR, yours is moderate. According to him, let me check this one. You have restrictive heart disease. Yes. Kilometer. Long QT. QRST. Naona hizi vitu zimechorwa hapa. Roho yako iki-contract huwa ina push blood. So blood hizi ziki-contract, they are pushing blood away. Right? Now this is what happens. Hii ikikuwa na signal huwa ina form P wave. Hii yenye naona hapa, hii P wave ni kubwa sana, huwa ina form P wave. Then sasa hizi zikikuja ku contract, hii inaendanga hivi, inaenda hivi, ina form U, inarudi na contract, inaenda. Kwa hivyo hii ni P, contraction ya hizi roho yako. So P R ST. So we check on QT. Namaanisha hizi zina take long to contract. Ina take so long to contract, whereby one of these valves must be having a problem. QT. Rheumatic heart disease caused by smoking. Najua is smoking. This one is caused by prolonged smoking. With this, there is nothing we can do for now. What you can do is you stop smoking. You stop smoking immediately, and you check on you are already on treatment, because what is suffering is this side. Your heart is suffering even like layer, and it says that You've been smoking for so long, bacteria zimeingia kwa heart, zimekuwa zikikula hiyo air. So you are on treatment. The treatment will go for more than 6 months. Hiyo injection moja yenye nilikuwa ukasema ni uchungu. That is what you are supposed to be on. But huyu daktari hapa alikuwa anasema left ventricular ejection fraction. On the left there is a problem. Yeye anasema hata hii kuna shida. So hii si mbaya sana, but there is a problem. Whatever I had suspected is what I started treating. Unaona? So according to me, my advice is, this is mostly brought by genetics or smoking for so long. When you smoke, that goes to your blood and it is deposited on these layers. So hiyo taa ya cigarette huanga inachukua bacteria. So bacteria starts to eat these layers here, mpaka these ones. So for now you are on treatment. I just wanted to confirm it is the cause, and I have confirmed. So please, Mr. Maingi, if you love yourself, stop the stick. I know why ukunywangi pombe. Yeah. Yes. So from next time utakuwa unadungwa nyuma. You are supposed to get that injection for the next 8 months. One injection per month for the next 8 months. Yes, that is the treatment. Ainanga any other treatment. For now, we'll be on hypertensives like spironolactone. For like 1 month, 2 months, nikiona imeisha, you'll be okay. We will remove you from the antihypertensive. Sawa. Let's go and see Dorothy mwambie baenye atakupea. Hii moja hii kopi nitabaki nayo, hii ingine utaenda nayo. Yes, Dorothy. Go with Mr. Mainge. Naona bado sijaarrange nini. Umpime bibi. Then you come and tell you what to do. Sawa? Yes. Yes, welcome back. Sorry, I was doing something, but it's okay. Sometimes when you're interrupted because of good causes, it's important. So we were talking about Chwea. I'm from Qatar. Watch hours is increasing like crazy. Give me motivation. Okay, now new people that are here, welcome so much. Welcome to the channel. And we were talking about bipolar complications. What are bipolar complications? Bipolar complications are complications of mood, depression, characterized by mania and hypomania. You get? So when they are characterized by mania and hypomania, you cannot definitely say that they have neurodevelopment dysfunctions of the brain. This is a condition by it is inherited, but there are some parts of the brain that we say they are involved, like the hippocampus and the amygdala. You get? Hippocampus and the amygdala. Yes, Savior man, what are you saying? I never knew that Bostua from Qatar, here at the Simple Cat, have pushed me to do like silent live stream. You do silent live streams. Do interactive, Savior man. People want to interact. So that is what I'm saying. And then we have reached at a place that whereby we have something called the HPA axis dysfunction. The HPA axis dysfunction. Hypothalamus, pituitary, adrenal glands, and cortisol. When someone is really stressed, there is a problem at the cortisol. There is a problem at the cortisol areas, and it releases a lot of steroids. The normal steroids that your body, excess cortisol damages neurons. Those steroids, the cortisols are steroids that your brain releases. If you release them so much, they damage the brain. You get? They damage the brain. So you start having anxiety, imbalances of some hormones, imbalances of some, and cognitive impairment. The normal cognitive function that a person usually has, you damage it. Neuroinflammation. Research suggests that increased inflammatory markers like interleukin 6, when you are having problems, they come to your bloodstream. Damages the neurons, worsens depressions and cognitive function. I talked about something called tumor necrotic factor alpha, the ones that helps your body not to have cancer. When you have cancer, it is the work of this thing, inflammatory marker of tumor necrotic factor, to kill the cancer cells. But when your brain releases tumor necrotic factor at levels, you will have neuroinflammation, and this will worsen the condition. So I've asked if someone has ever met or associated with someone with bipolar. We are just introducing this topic today, and we would like to know more about bipolar dysfunctions. Neuroprogression is how your brain progresses throughout. You see? Yes? Spinal actor? Echo? Check. Yes, uncle. Blessing Jamaican uncle. Echo? Yes, I'm coming. That's fine. I'm coming with it. Yes, my guys, don't worry today. I told you it's a Monday, so you will expect me to be having some breaks every time, which is okay. Be okay with I am handing over this treatment, then I'll come around so that we see what to do. Just give me 2 minutes, I'll be here. 2 minutes, I'll be here. Yes, I'm here again. Now, before we finish, anyone who has any question concerning bipolar disorders, today I was introducing, and we have some things to cover. That one was just an introduction as always. This topic will cover the whole of this week. We want to know, even if the course is unknown, there are some things we should know that are so many. So, okay, anyone who has any question that would like to ask about bipolar disorders, or any question that we have covered that you didn't understand well and anything, please ask any question that you didn't understand. Okay, I have a premiere out on Wednesday, 11 UK time, 1 p.m. Kenyan time. Okay, I will be there, Smiler in the city. I will be there. I will go there and give a notification. Yes, American uncle schedule I changed. Anyone with any question before I log out? I can see I have 9 minutes. I have 9 minutes. 9 minutes to go. But remember, after this is 6, 7, 8, 9. After 3 hours, we usually come online to answer questions of everyone. So if you feel you are Smile in the city, I'm okay, a little tired, sipping my black gold, listening in, and you is sipping her black gold. Yes. Nice. I'm waiting for your questions before I log out. 8 minutes to go. 8 minutes to go. Okay. I'm back, but I'm trying to add the number. What is the number 4? It's the last 4 numbers. Bloody, this is the number. Plus 2, 5, 4, 7, that is 6, 0, 24. There is at Bloody. Bloody, that is the number. That is it. What's up on that? Okay. Sorry to hear that, but I swear I don't do any silence. Yes, silence are not, interactives are more better. Interactives are more better. Okay. But you should not delete them. Once people have viewed and have given some hours, you just leave them there. Next time, please bring the topic about memory, how it works, why. Oh, FRC is saying we bring topic about memory, how it works, why is it that we remember and forget other information. I kind of like brought this topic up, FRC, on a topic that we were discussing, but on the playlist of mental health. I've brought it. I can do, because it is in very many categories. FRC, I think at night I'll talk about memory. If anyone will not be around, they can revisit and check. So after 3 hours, that is Kenyan time, that will be 9. At 9, I'll be talking about memory. Because it is entailing all these things that we are talking about, they are entailing memory, and it is very important. About memory. And the brain. Yes, that time I will be talking about that. Yes. Bloody, I'm not Jamaica. I'm in Kenya. Kenya is in Africa. Kenya is in Africa. Anyone in Jamaica right now? Oh, okay. Good. Thanks. Anyone in Jamaica right now? So, any question? 4 minutes to go before I log out. 4 minutes to go before I log out. I've just introduced the bipolar complication. We will talk about the treatments, because there was a question about how we can prevent it. Xavier Man is saying Dr. Ben is now a Jamaican. Okay. Uncle, I think it's going to be easy for you. It will be at 6 a.m. Okay, nice. There are several things that we'll talk about when it comes to treatment. Like I have 3 minutes, let me clear up. Like cardiovascular resynchronization therapy, very important. Implantable cardioverter defibrillator. Those are things we use. Imagine in bipolar, it is called device therapy. Advanced surgical treatments. With ventricular assistant device. Heart transplants. I generally wake up at 8. Okay, heart transplants, imagine. If it is affecting even the heart. There are some people who have problems that are affecting even So thanks for coming in. And if your condition is about bipolar, now you know it is not related to neurodevelopment. It is something that is connecting to the heart. So 2 minutes to go. Any question? 2 minutes to go. Any question? Anyone who knows something that is called kindling phenomenon? When it comes to treatment, we will talk about kindling phenomenon in bipolar. So just for now, everyone know it is a genetic thing, and neurotransmitters like serotonin, GABA, and others are involved. Serotonin, DOPA, GABA, and norepinephrine, the four are involved. Okay. Very nice, very nice. Thanks for logging in and learning about bipolar and your contribution to everything. I'll come at 3 hours time, at 9 Kenyan time. I'll be talking about memory and the brain. It has been a request, and you are kind like to let me know if you got it. Yes, let me check. It has been a request, and no, Blue D, I've not got it. Please resend. Check the number that you used. Check the number that you have used as 25. Blue D, check the number well, because it's supposed to be plus 254 9297. Yes. Meisha. Yes, ceftriaxone 1 atakujia zingine 2. Yes. So nice time. Let's meet Jamaican uncle. I can't sleep like that in the US. Let me know. Blue D, I've not seen it. I'm refreshing and I'm not seeing it. I'm refreshing and I'm not seeing it. Okay, have a nice time. I'll see you at Jamaican Uncle's premiere, and we meet at 9 to talk about the brain and memory. So everyone who has been here, thank you so much. Let's meet the other time. Bye. See you. Let's meet at I think 7. I'll be interacting at Jamaican Uncle. So those that will be there, we can interact. Bye.